Hey, everybody, welcome back to the Monday Afternoon Journal Club. Ed Bowder and Dan Schwester from the Overrun here. Danny, today we're going to talk about a paper coming out of Greece that talks about beauty parlor strokes, which is a condition that our listeners might not be aware of.
Yeah, really interesting case series. I think it's a case series, I would suggest. This is a phenomenon that is related to hyperangulation or hyperextension of the neck, just like you would do if you go to get your hair cut, get your hair washed. Dental procedures always involve you tilting your head back like this. What they found is a series of cases that caused actual damage to the vertebral arteries, causing stroke-like symptoms. It's a very interesting thing. It doesn't happen a ton, but it's out there for everybody in the pre-hospital world that deals with strokes. This is an interesting piece of history to get from your patient. Not only last known well or time of symptom onset, what was that patient doing at the time? And I can tell you anecdotally, I had at least one case like this in a beauty parlor. Older female had walked in, everything was fine, got in the chair, went to get her hair washed. Next thing you know, she's having stroke symptoms. At the time, how do you know? But yeah, looking back, could be.
And what we like about this paper is, again, this is a meta-analysis that looked at 22 studies in this actual paper. The primary symptom, equilibrium and motor disturbance, followed by dizziness, nystagmus, and headaches. So, and again, this paper is a little bit dense, even for the papers that we typically go through. But again, talking about the incidence of these and just making people aware of what the hairdresser stroke is. So essentially what these affect, and we talked with Greg Klopp last month, I believe, on the podcast about hyperangulation injuries as it pertains to intubation. And there's people who have had, C2, C1 atlas stroke injuries from, having osteoporosis or having really weak bones and having their head hyperangulated. Right. In this setting, the concern is over the vertebral artery. So especially in the elderly, and especially if the elderly patient is taking a blood thinner, something like if they've been taking aspirin or Eliquis for a long time, what those medications actually do is over time, they reduce the integrity of the epithelial lining of the actual vessels. And in some cases, there's myriad pathologies, especially in the elderly, that can cause sclerosis of the actual vessels and make them rigid. So you have the outside of the vessel that's rigid and the inside of the vessel that's damaged. And the vertebral artery runs through the foramen of the actual vertebrae. So what happens in these patients is you have whatever type of insult to the vertebral artery that's already there. This is something that you're probably not going to find before you present with symptoms. It's really difficult to run a CT and see a problem with the vertebral artery. It's really difficult to cannulate. So it's really hard to know that someone has a thrombus in their vertebral artery. But what happens is when you're at the hairdresser, you go into the sinks and they tilt your head back. And that hyperangulation of your neck can cause a pinch in the vertebral artery, which will cause a reduce in blood flow, reduce in oxygen, or it might dislodge a clot and actually, make that occlusion much more significant. So you'll see these patients who will just be getting their hair washed and will suddenly start to show symptoms and signs of stroke. And from the clinical side, it's actually kind of good because you can see that moment of onset. Right? We know, okay, Cheryl came in at 2:00. She got her hair washed at 2:05 and she had symptoms at 2:07, right? So that's all really good from our side. Knowing that this particular cohort of patients exists, I think is really interesting, especially if you're in an environment where you and I work, Danny, where the population that is over the age of 65 is really, really significant. This is a group of people who, and this is where, sociology comes into medicine, right? Where they go to beauty parlors fairly regularly, right? If you live, and something that is probably not thought of, if you live in a predominantly Muslim community, there's a lot of people that will go to beauty parlors, especially women. So look at the community that you're in and how often people are actually at these beauty parlors and consider the population that's there. This is one of those calls where I promise you, if I was dispatched to a beauty parlor for a stroke, before seeing this paper, I would probably roll my eyes. It's like getting dispatched, to a sports complex for difficulty breathing. Like, yeah, they were running. That's what happens. So, but seeing this, I think that my approach to these stroke patients can be a little bit different, knowing that there's this possible, right, insult, this possible sequela that they might have.
It's a very interesting mechanism of injury. It's not something that you get in EMT school, paramedic school. I would even argue nursing or medical school.
I don't think the vertebral artery is ever taught in EMT or medic school.
No, I doubt it. But it's a very interesting mechanism. It explains a lot, and it can provide some really good information for the receiving stroke team. So if you're going to these calls, or if you're in a situation like this, or even in a home situation, what was the patient doing before this happened? It's a good question to ask, because it might give you some really good insight as to what potentially is going wrong. Look, they still need the CTA, CTP. They still need a whole workup, but this can actually kind of delineate a little bit better for a doc that's trying to figure it out.
Well, and this is what we talk about, right? Like the importance of pre-hospital care sometimes is just monitor and transport and just getting the best patient information that you can get, right? Where, you know, in a lot of traumas, it's easy, right? One thing led to another. The patient had several bullets put into them, right? It's kind of an easy way to approach it. But I think sometimes when we take histories, we focus on their last known well or the last known normal, and not necessarily what was happening at that time. Right. Now, in trauma, again, I think it's kind of easy, right? Like you fell and hit the side of your head 10 minutes ago. Easy, right? We know what that incident is. But here, this is also a case where these patients may present acutely in the actual salon, but they also might have an actual delayed response when they get back home. So when it comes to the history taking part, now this is not, stroke patients pre-hospitally are not patients we do a lot for. A lot of it is recognition, transport to the hospital. Now, we can have different discussions on field TPA and field CT units and all that stuff, but generally speaking, EMS takes stroke patients to the hospital.
Yeah, we're scouts, we're reconnaissance, we're not fighting the battle.
And that's the point, is that in these settings, we do that recon, we get those stories, and it's like, listen, I think this could be a vertebral artery stroke because she was at the hairdresser an hour ago. Right now, and whatever, maybe you're wrong, but at least it guides the stroke team and the neuro team to finding the right outcome or going down a path that they may not have gone down previously. This is a rare occurrence. It's not something that you're going to see regularly, but in those patients where, you know, you walk in and they're like, this is just really weird. This is something that you can think about now, right? Vertebral artery stroke from, how are they calling this? Beauty parlor stroke syndrome. Is the actual syndrome, beauty parlor stroke syndrome.
I guess it's better than calling it chiropractor stroke syndrome.
It is better than that, yeah. I think we could, you know, get it's Becky with the good hair syndrome.
Yeah.
But let us know if you guys have seen this. It's an interesting kind of case study, interesting things to think about on scene. Check out all of our content at Overrun Productions and TikTok and on EMS One and everywhere else we do everything. For the Overrun and for the Monday Afternoon Journal Club, Ed Bowder and Dan Schwester, we will talk to you next week.
Take care.